death have been much exaggerated. As you can see, I'm fine. Got my tan from the Bahamas. Today, I got a letter from my RT friend, Bob. And he gives me information once a week on different events going on in the hospital. In fact, I got a letter here right now. Let's take a look and see what it says. Ooh, today it's going to be atypical mycobacteria. Dear Mr. Rogers, I sent this letter to you for your reading pleasure. How nice. Atypical mycobacteria are a group of bacteria that are widely distributed in nature. They can be found in water, soil, animals, and man, usually without evidence of the disease. Most infections with these organisms are believed to arise from environmental exposures to organisms in infected water, soil, dust, or aerosols. Person-to-person and animal-to-animal transmission of atypical mycobacteria is not an important factor in acquisition of infection of these organisms. Wow, very interesting. In fact, why don't we pay a visit to my respiratory friend, Bob? You know, before we go, I think I better make a trip to the ATM.
It's a beautiful day in this neighborhood, a beautiful day for a neighbor. Would you be mine? Could you be mine? It's a neighborly day in this beauty wood, a neighborly day for a beauty. Would you be mine? Could you be mine? I have always wanted to have a neighbor just like you. I've always wanted to live in a neighborhood with you, so let's make the most of this beautiful day. Since we're together, we might as well say, would you be mine? Could you be mine? Won't you be my neighbor? Won't you please? Won't you please? Please won't you be my neighbor? It's a beautiful day in this neighborhood, a beautiful day for a neighbor. Would you be mine? Could you be mine? It's a neighborly day in this beauty wood, a neighborly day for a beauty. Would you be mine? Could you be mine? I have always wanted to have a neighbor just like you. I've always wanted to live in a neighborhood with you, so let's make the most of this beautiful day. Since we're together, we might as well say, would you be mine? Could you be mine? Won't you be my neighbor? Won't you please?
Whoa, stop, Mac Daddy.
Won't you please?
According to this, you might be infected with Mac. Come follow me and get tested. Come on. 2 days later. Hello, neighbors. We're here today at Make Believe Hospital where we took our friend, Mr. Mac Daddy, for his evaluation. Also, I have my friend here today, Respiratory Care Bob.
Hello, neighbors. What's up? I understand you have a friend here for evaluation for atypical mycobacterium disease.
Yes, that's what the ATM told me there, Respiratory Care Bob.
These are infections that are caused by a species of mycobacterium that are similar to the Mycobacterium tuberculosis. They can be found in water, soils, animals, and humans without evidence of disease. These infections are found frequently in people with HIV. Rod-shaped bacteria. Early scientists knew that there were different species of the Mycobacterium that acted differently than Mycobacterium tuberculosis. Today, scientists have been able to classify the different species into atypical, non-tuberculous Mycobacterium. Mycobacterium marinum, known as fish tank granulomas, is from exposure to contaminated H2O. Mycobacterium ulcerans, also known as Buruli ulcers, found in Central and West Africa. Infections destroy blood vessels, nerves, and invade bone. Form skin lesions. Mycobacterium kansasi, second most common, can form skin lesions, causes crackles, wheezes. Mycobacterium avium intracellular, also known as MAC, the Mycobacterium avium complex is a rare lung disease in healthy individuals. It is frequently found in people that have low resistance caused by another disorder. People with AIDS are almost always attacked by this bacteria. Their poorly functioning immune system enables the microbes to rapidly multiply. Diagnosis can be made from patients, symptoms, and culture stains. Chest x-rays are used in cases of lung infections. Your friend Mac Daddy is being handled by respiratory care practitioner Lynn.
Okay,
Let's go see her.
let's go.
Hello, Mr. MacDaddy. I'm Lynn, your respiratory care practitioner. I'm going to listen to your lungs. I'm going to take your pulse. I see you've been admitted for various discomforts, including shortness of breath, fever, night sweats, weight loss, loss of appetite, fatigue, and progressively severe stomach pain, vomiting, nausea, and diarrhea.
Hi, respiratory care practitioner Lynn. This is Mr. Rogers.
Hello, Mr. Rogers.
Hello.
Respiratory care Bob. You're just in time for a sputum
I'll see y'all.
and a stool culture. Nurse! Sure am glad I'm not a nurse. As we learned earlier from our friend Respiratory Care Bob, M. avium intracellular, or MAC, is a rare cause of lung disease in otherwise healthy humans, but a frequent cause of infection among those whose resistance has been lowered by another disorder, in other words, opportunistic infection. According to some experts, MAC infection is almost inevitably a complication of HIV. The infection is caused by one of two similar organisms, M. avium and M. intracellular. AIDS patients almost always are attacked by these mycobacteria. Once inside the body, the atypical mycobacteria, bacterial organism colonized to grow in the lungs, like tuberculosis. Because AIDS patients have poorly functioning immune systems, the microbes multiply because they aren't stopped by the body's normal response to infection. Once they have colonized in the lungs, the organisms enter the bloodstream and spread throughout the body, affecting almost every organ. These devastating infections can invade the lymph nodes, liver, spleen, bone marrow, gastrointestinal tract, skin, and brain. As we observed in our patient, symptoms include shortness of breath, fever, night sweats, weight loss, appetite loss, fatigue, and progressively severe stomach pain, nausea and vomiting, and diarrhea. If the infection spreads to the brain, the patient may experience weakness, headaches, vision problems, and loss of balance. Now let's go back to Respiratory Bob's office, and we'll see you later.
All right, Mr. Mac Daddy.
Hello, Respiratory Care Bob.
Hi, Mr. Lynn. Hi, Mr. Rogers.
Hello there, my friend.
The diagnosis was made from the patient's symptoms and organisms grown in culture from the site of his infection. In cases of lung infection, a diagnostic workup should include a chest x-ray and tests on discharges from the respiratory passages. In other words, sputum. Mr. Mac Daddy has been diagnosed with a form of atypical mycobacterial infection.
Treatment? It's not easy to treat. Antibiotics don't always work. But some of the drugs used are rifabutin, chlorpheniramine, and then they use combination drugs of ethanamide, cycloserine, ethambutol, and streptomycin. Prognosis doesn't look good. Since the drug therapy is not successful, there's a very high mortality rate. To prevent it, people with HIV can just try and delay the onset of the infection. They can drink bottled water, avoid raw vegetables, and use unpasteurized products.
Well, thank you all very much, neighbors. This has been very informative. Okay, I'm off to go home. Thanks again. Bye.
Goodbye,
Bye,
Mr.
Rogers.
Rogers. Goodbye.
It's such a good feeling to know you're alive. It's such a
Bye,
happy
neighbors. Till next
feeling.
time.
You're growing inside, and when you wake up, ready to say, I think I'll make a snappy new day. It's such a good feeling, a very good feeling, the feeling you know that I'll be back when the day is new, and I'll have more ideas for you, curious, and you'll have things you'll want to talk about. I will too.